What's in this report? First, to kind of set the background a little bit, when this outbreak occurred, it kind of proceeded, the investigation had proceeded along three lines, or there are three components to what happened next. First, of course, and most important to us here at the Mayo Clinic, was the care of the patients. So there were a number of patients that were ill that came to our attention, and we undertook an extensive set of investigations to really try to figure out what was going wrong and to try to find the best thing to do to take care of them. Of course, this was a public health concern. It appeared to be an outbreak, and so, of course, the appropriate authorities became involved, the Minnesota Department of Health, Center for Disease Control, and a number of other entities. The third component of this that occurred in tandem with the clinical care of the patients and the public health investigation was a basic science investigation. We all realized that this was something really quite novel, something that had never really been seen before, at least in the modern era that we were aware of. And so all of us took great efforts to try to understand from a basic science perspective what was really going on. And to some extent, all those three things overlapped. In our report, we're presenting primarily the results of the clinical investigations and clinical care of the patient, and the basic science, at least as far as we undertook that investigation here at the Mayo Clinic. There was a little bit of overlap between the public health investigation and what we were doing at the Mayo Clinic, and some of that relates to what's really new in this paper. As part of the Minnesota Department of Health investigation, they screened a number of individuals at the plant who appeared well and without symptoms. And a number of those individuals, actually just over 100, donated a sample of their blood for future study. A part of those blood specimens were shared with us in the neuroimmunology lab for testing for antibodies, which might indicate a response to this brain exposure. And indeed, in our patients, in every single case, we found evidence for an antibody response to this exposure in their blood. And as it turns out, a third of the individuals who appeared well also developed an antibody response. Interestingly, it turns out that we were able to plot out the distance between the point of exposure with the production of this mist of brain and the primary place where the individuals worked. And as it turns out, there was a reverse relationship or an inverse relationship between the distance from the place where they worked and the point of exposure and the amount of antibodies that were in their blood. More simply put, the higher their antibody levels, the closer they worked to the point of exposure or the production of this brain mist. And that relationship was true both for all of the patients and for these healthy individuals that appeared well. Well, you might ask, why would healthy individuals also have these antibodies? It is our belief that the antibodies indicate the body's immune response to an exposure, but there are other factors, many of which we really don't understand, which relate to getting sick as a result of this exposure. Some people are exposed but just didn't get sick. Now, in terms of the follow-up, obviously nearly 2 years has passed since we initially identified this outbreak, and we've been following most of these individuals since that time. Moreover, we've provided snippets of the follow-up information at our various scientific meetings over time. At the American Neurological Association meeting this past fall, Drs. Dick and Tracy and myself were able to report some of the follow-up data on the more objective measures that we've been following these patients over time. And in every single case, all of the measures improved. This includes the MRI data, the electrical data, the physiological data, and though not reported this past fall, we can also say that the antibody response has also diminished in these individuals over time. Additionally, at the American Neurological Association meeting this fall, we presented additional evidence on the nature of the antibody response in these individuals. As you might imagine, this brain mist is a conglomeration of brain material, and that there are many components that the patient's immune systems can react to. And what we've in fact shown, actually both in this paper that will appear this week and in the data that we presented at the American Neurological Association meeting, that the antibody response is indeed to multiple different components of the nervous system.